This is an article that came out on NPR January 17th, 2018. Opioid plague blamed for sharp increase in accidental deaths in US. Accidental deaths in the United States rose significantly in 2016, becoming the third leading cause of fatalities for the first time in more than a century, a trend fueled by the steep rise in opioid overdoses. The National Safety Council reports accident defined by the council as unintentional preventable injuries claimed a record 161,374 lives in 2016, a 10% increase over 2015. They include motor vehicle crashes, falls, drowning, choking, and poisoning, a category that encompasses accidental overdoses. NSC said in a statement, the unprecedented spike has been fueled by the opioid plague. Unintentional opioid overdose deaths totaled 37,814 from drugs including prescription opioid pain relievers, heroin, and illicitly made fentanyl. By comparison, motor vehicle deaths were at 40,327 in 2016, a 6.8% increase from the previous year. It's probably all them junkies driving behind the wheel all high on heroin, opioids, and everything else. Deaths related to falls were also up by nearly 4%. And drownings and fire-related deaths saw slight increases from 2015, up 5.1% and 3.2% respectively. The only category to show a decline was choking deaths, which were down 4.4%. Ohio led the nation in opioid overdose deaths with 3,495, followed by New York with 2,752, and Florida 2,622. Poisoning deaths hit a peak for those in their early 30s, but there is another spike in early 50s, the statistics show. Okay, so it says preventable deaths have been rising since 2009 after years of decline and plateaus, and they trail only heart disease and cancer. When it comes to the number of lives lost annually, unlike other causes of death, preventable injuries are a threat at every age. In spite of the current increase in deaths, Americans are still safer than the early 1900s. In 1903, the accidental standardized death rate was 99.4 per 100,000 population. Woo! Mm-mm-mm. Twice as high, the current death rate of 47.2. However, the current death rate is 39% higher than the lowest recorded rate, which is 34.0, achieved in 1992. In October, Trump declared a public health emergency to combat the opioid plague, a move designed to free up some resources for treatment. He also directed agency and department heads to use all appropriate emergency authority to reduce the number of deaths from opioids. But the president's move is still seen as a half measure by many of his working class supporters because it involves no new money. That's what they hate the most. Woo, they hate that more than anything. It falls short of Trump's earlier promise to declare the crisis a national emergency, which would have triggered an allocation of federal funds for the crisis. No, because America would go broke if they did that. Please tell me what you think, ladies and gentlemen, about this sharp increase in accidental deaths in the US. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and also join me over on Black Junction TV and blackspot.com. Peace, family.